Good morning, good afternoon, good evening from wherever you're joining us from. It's good morning from Nigeria. My name is Gift Ndubisi and I'm the Secretary of the Academic and Grant Writing Enclave. And on behalf of the Academic and Grant Writing Enclave, I extend the warmest welcome to each and every one of us distinguished participants. Welcome to this very impactful webinar. And I trust that by the end of this webinar, you would have gained a lot and you would have learned a lot. With us already seated is our facilitator for today, in person of Dr. Ezekiel Musa. But just before we have him take the stage, I would like to give us a brief introduction of our facilitator. Dr. Ezekiel Musa, an esteemed physician and consultant endocrinologist, is a clinician scientist and a dedicated academic. He is currently serving as a senior lecturer and consultant at Kaduna State University Biomedical Teaching Hospital. Dr. Ezekiel Musa is on a leave of absence in the United Kingdom. Boasting an impressive academic background, he holds an MBBS Fellowship of the West African College of Physicians in Internal Medicine with sub-specialization in endocrinology. And he also holds a PhD in medicine from the University of Cape Town, South Africa. His commitment to cutting-edge research is evident through collaborations with renowned institutions such as the University of Cambridge, the University of Oxford, where he held a Newton RC-UK PhD Exchange Partnership Fellowship, and also the University of Cape Town. Dr. Ezekiel Musa has contributed significantly to the scientific community with publications in high-impact journals and presentations at prestigious international conferences. He is recognized for his outstanding contributions, and he has received numerous prestigious awards, including the YW, that's the Look New Investigator Award by the International Federation of Placenta Associations, and this was in 2021. He also received from June to November 2019, the Newton RC-UK PhD Exchange Partnership Fellowship to the University of Oxford. And he also received scholarship for placenta biology course at the University of Cambridge, United Kingdom in 2019. He also received the International Society of Endocrinology, that's in Switzerland, Travel Fellowship Award in 2018, and also Type 1 Diabetes Fellows Award by the Endocrine Society in San Diego, USA in 2015, and also the Endocrine Society Early Career Forum Award, also in San Diego, United States of America in the year 2015. His dedication to research, patient care, and medical education is truly, truly commendable. So distinguished ladies and gentlemen, if your hands are not too busy, kindly join me as I welcome our facilitator for today, Dr. Ezekiel Musa. You're welcome, sir. You may please unmute the mic and have the stage. Thank you.
Thank you so much, Ndubisi. Good day, everyone. You're all welcome to this great forum for sharing academic resources. This morning, over here in England, I will be presenting structured approach to writing impactful research papers in medicine and basic medical sciences. I would like to take this presentation using this format. I'll quickly introduce the subject and then look at the types of papers or manuscripts, which journal you may wish to publish in medicine or in basic medical sciences, and very importantly, the practical steps in writing impactful manuscripts. And then finally, we will have an interactive session with colleagues. And from this slide, I would like to ask all my colleagues, those who are doctors, those who are researchers in basic medical sciences, academics, teachers in the university, to just type in your upcoming manuscript, just the title, just type it in our chat box, and then our admin will collate all the titles. And then at the end of this presentation, I would like us to go through those titles and see if this presentation has worth a while. So let's begin. What is research? Research is a process of systematic inquiry that entails data collection, documentation of critical information, analysis and interpretation of data in accordance with suitable methodologies set by specific professional fields and academic disciplines, leading to finding new facts, new information, and verifying available knowledge. What is medical research, or what is research in medicine? This refers to the process of using scientific methods to produce knowledge about human diseases, the prevention and the treatment of illnesses, as well as promotion of health. So for every form of research you carry out, using the right methodology that produces knowledge which shapes the understanding of human disease, the understanding of the pathophysiological basis of diseases, as well as prevention of such illnesses and promotion of health, is what we call medical research. So if you want to do a research in medicine or in basic medical sciences, you're a nurse, you're a physiotherapist, you're a medical lab scientist, you're in anatomy, physiology, medical biochemistry, nutrition, and so on, and your research is not targeting these, various perspectives, it therefore calls for some questioning. So the theme for medical research is to produce knowledge that will help in understanding human diseases, prevention, treatment of illnesses, as well as promotion of health. How do we classify medical research? Principally, we've got two main forms of medical research. The first is the primary research, the second is the secondary research. Under primary research, we've got clinical research, where the main thrust of the study is on clinical disease, is on clinical trials, is on clinical problems. You are trying to solve a clinical issue, and then you want to undertake a clinical research to better the lives of patients. And then we've also got basic medical research, where the main thrust of your work is lab-based. You are right there in the lab using biological samples, interrogating them in the lab using modern techniques such as genomics, such as molecular biology techniques, such as all sort of modern research like proteomics, metabolomics. All these constitute basic medical research, and we do all this great, and we apply all these great techniques in order to understand critically what mechanisms underlie human diseases, and also understanding the pathophysiological pathways of common diseases affecting mankind. And then we've also got epidemiological research, where we study the distribution of diseases based on where it is happening in terms of location, based on timing. All these are very important. Like, for instance, in the time of COVID-19, many epidemiologists went to town studying the parameters and the determinants of COVID disease, determinants of severity of COVID infection, and determinants of mortality in patients who are infected with COVID-19 infection as at that time. So this is very critical today. So if you are a doctor or you are a paramedic or you are in basic medical sciences and you want to have a research career, you need to ask yourself, where do I want to focus on? Is it clinical research? Is it basic research? Or is it epidemiological research? But if you want to be like me, you can combine two or more, like combining clinical research as well as basic medical research. And for me, it is just my personal opinion. It will be good if you are able to combine at least two out of these three. And that will help you to have a very beautiful and well fulfilled research career. And then the second type of research, secondary research, is a very important form of research that is gaining grounds today. And the good thing with this type of research is that you do not need biological samples. You do not need a wet lab, because you might be asking me, oh no, I don't know how to pipette, I don't know how to how to do this, how to do that, I don't know how to do ELISAs, I don't know how to do Western blotting, I don't know how to do real-time PCR, and all that. Yes, but we've got secondary research which constitute systematic reviews and meta-analysis, scoping reviews as well as review articles. So, but I would like to, expatiate more on systematic reviews as well as meta-analysis. Now, this form of research essentially include the use of structured, search of data, search of articles in a certain area of endeavor over a prescribed time using specific methodology so that it can be reproduced by another researcher elsewhere. And this form of research has been shown to have great impact, to have great value when you want to make a clinical decision as to what is the most important therapy for this type of disease, for that type of disease. For example, diabetes. A few years ago, the first line of treatment for type 2 diabetes was dietary or lifestyle modification. And so when you visit a doctor, they will tell you, you need to go and do exercise, you need to eat healthily, you need to do this, you need to lose weight, you need to do that. And then come back after a certain time. If your blood glucose is not controlled, they will add metformin. And then over time, robust research and evidence from several, systematic reviews and meta-analysis provided us with, new insights, where we now understand that although lifestyle modification and metformin use have got equal efficacy in terms of A1C reduction by 2% over a period of 3 months in those who have type 2 diabetes. But in that same, or in those studies, rather, it was discovered that use of metformin had greater value and superior, benefit to lifestyle modification, in that it prevents cardiovascular disease in patients with type 2 diabetes. So we could see that basic medical science research wouldn't have given us that information, but a systematic review could give us this kind of information. And so perhaps you want to indulge in such researches and you think you don't know what to do, is something you will pay attention to, and I can have some time to discuss with you at the end of this presentation. Recently, I had a group of young consultants and senior consultants as well, great scientists, who were close to me. And I said, look, can we look at this? And we quickly looked at a systematic review on mHealth. And I can tell you, we're able to publish our protocol in a high impact journal that many of my colleagues were, surprised. And we have finished the manuscript. We have sent to a very big journal, and there is high possibility that our paper will publish anytime soon. So that is an area you can look at. You don't need to go to lab. You don't need to pay any laboratory scientist money to do this for you. So I've taken time to do this because I know resources are a huge problem in developing countries, where you might not find funding to do credible research, to do high impactful research. But I tell you, right there in your room, using your computer, you can do a very good systematic review and meta-analysis that can put you on the map. What are the general facts about research in medicine? Number one, it requires passion and dedication. You don't just think, oh, I want to do research. There must be passion. It will cost you your money. It will cost you sometimes even your career. I had to have, a career break to go for my PhD in medicine, just in my quest to understand what I am doing properly and in a systematic and dynamic fashion. So it may take your money, really, it may take your time. But if you want to be a great researcher, you need dedication and passion. Research integrity is very, very critical. Very, very critical. I see a very damaging trend in medicine, particularly research aspect of medicine today, where people indulge in what I call research contribution, research cooperative organizations, where you have a group of 20 people, 10 people, 15 people who are close to each other, group of friends. This one will write and then put the names of the other people. Another person will write, put the names of the other people. And then at the end of the day, they boast of having 20 publications, 30 publications. At the end of the day, we have got academics, medical teachers, university professors without substances. And that is why research integrity is very important. People must be listed as authors or co-authors if they have contributed significantly to the intellectual input in a certain manuscript or paper, particularly when it has to do with medicine. Quality is better than quantity. I must spend some time here as well. You may ask why quality. On so many occasions, I've had to have, so much academic debates with colleagues, where some people feel, oh no, just publish, become a professor, and don't just focus on high impact journals. But I tell you, you can publish and become a professor. But the question is, when we talk about experts, when we talk about leaders in that field, will your name be listed? The question is capital no. It's highly unlikely. And that is why we see lots of professors, if you put their names on PubMed, you see zero, no data. You put their names on CNL, for those who are in paramedics, is zero, because they publish in papers that have almost no impact factor, because they want to get promotion on time, they want to become professors on time, but yet the intellectual quality of such individuals is almost nothing. And that is the essence of this presentation, I guess, from the organizers. They want to see how they can contribute to quality research in medicine, particularly in Nigeria and other developing countries. Our most revered medical teacher, for those of us who studied medicine, I'm sure you must have come across a textbook of medicine, particularly a clinical method textbook of medicine we often refer to as Hutchinson's. Sir Robert Hutchinson said, the amount of writings of a profession is a measure of its vitality and activity, whilst their quality is a rough indication of its intellectual state. So if I see your paper, I can tell how much of intellectual input you have put into that work. Just to give you an example, when I was to publish my PhD work, my idea was to, oh, look, let's get fairly useful, high impact journals and put, different manuscripts in. And one of my supervisors from the University of Cambridge, and the professor now advised, said, look, she called my first name, she said, look, Ezekiel, it's good we have a very quality paper and put it in a very big journal than to break them into smaller papers and then smaller journals as well. And then we said, okay, that's fine, Prof. And then we moved in, started the work. It was highly intensive, almost every day, emails here and there, communicating between big professors across the globe. And then at the end of the day, we finalized that manuscript and we submitted it in a journal of physiology, which is reputed to be the most cited journal of physiology in the world. And so our paper was accepted within a very short period of time. And for that particular edition, our manuscript was, selected as editor's choice for that time. And I can tell you, about 25 media houses across the world, published the excerpts from our work. And University of Cambridge, University of Cape Town also published the excerpts of our paper on their websites. If you check today, you just type my name and maybe type the title of the paper, you will see in those websites. What am I trying to say? I'm trying to emphasize the need for quality than quantity. We also need to know that unless a research output is published, findings are almost valueless. What I mean by this is that it doesn't matter the good work you've done in the lab. It doesn't matter, the great intellectual input in that work. If you don't publish it, it's almost valueless. So you have to publish it. Whether, you publish in a journal or you present in a conference, there should be some sort of publishing in order to share what you have, the data and the new knowledge you've gained from your most recent research. And I'd like you to know that when you indulge in good research in medicine, you might get, a patency, or you may win a Nobel Prize in medicine and physiology. So isn't that a good news? So yeah, and that shows that you have to be consistent in a certain area of research, where I have said here that have a consistent specialized research focus. Don't just do research in stroke. You are doing research in diabetes. You are doing research in kidney disease. You are doing research in cholera. You are doing research in TB. You are doing research everywhere you find yourself. You are doing research. At the end of the day, you may have 200 publications, but you are not a specialist in any field of medicine as far as research is concerned. And so for you to do that, if you are very young in research, try as much as possible to have at least 70% of your research indulgence in a specific specialized research focus. And then research requires collaboration. You can't do it all by yourself. All that I have achieved, as an upcoming researcher is based on the fact that I have stood on the giants, on the shoulders of giants. I have had great mentors. I've had great teachers, leaders in their fields globally, who happen to be my mentors. Just to tell you, recently, I was privileged to be invited to be part of the scientific committee saddled with, providing insight into hyperglycemia in pregnancy, research group for International Diabetes Federation, which is the Zenith association overseeing clinical diabetes and diabetes research in the world. That couldn't have happened if I didn't have the giants that I am collaborating with. And I find myself sitting with leaders in diabetes and pregnancy research across the world. So you need collaboration. When you go for a conference, don't just enjoy the beauty of the city or the beauty of the research venue or the conference venue rather, but look for collaborators. Walk in, meet those big professors. They are very approachable. They are very simple. Meet them, introduce yourself, tell them where you come from, tell them your interests, tell them you want to collaborate with them, tell them you're interested in this and that and that. I can tell you, if you approach 20 people, 10 people, 1 or 2 will agree to hold you and to support you. Collaboration is key. So we are moving very close to the myth of our discussion. We want to look at preliminary steps to writing manuscripts or papers in medicine or basic medical sciences. Number 1, you need to appraise the research work you have performed. And what are you to do? What are the key questions you need to ask yourself? Number 1, have you done something new and interesting? Not just, because my colleague in Sokoto has looked at the prevalence of hypertension among pregnant women. And then you are in Bielsa and you say, oh no, I can replicate this paper by looking at the prevalence of hypertension among pregnant women in Bielsa. The question I want to ask you is there any specific epidemiological differences between women in Bielsa and women in Sokoto? Why do you have to do that research? So we have to ask ourselves, are we adding any new information, or are we bringing in any new knowledge by indulging in a certain research? Question 2, have you checked the latest results in the field? Many researchers do not study. They don't read. We just do what? Maybe you are a trainee, you're doing your master's, or you're doing a PhD, or you're doing your fellowship. Many of us just do what our supervisors have asked us to do. But the question is, have you done an extensive review of that particular field? Because sometimes if you don't do an extensive review, you find yourself doing a research that another person has asked you to do, and then at the end of the day, you have no interest in that field, and then it leaves you with frustration, it leaves you with depression, it leaves you with dissentment as far as research is concerned. But if you do a quick review of that area, you'll be able to see potential gaps, you're able to see potential areas you want to fill in, and that way you'll be so excited, you'll be so impressed with your area of research. So please, as young academics, young researchers, we need to study very well in areas we want to indulge in. Number 3, have the findings been verified by appropriate analysis? Recently, I was just trying to search the literature to add to my articles for a systematic review I'm doing. with colleagues across the world. And I came across a very beautiful paper that was published by some people in some parts of Nigeria. And I mean, the paper was beautiful. It was a good study. But number one, I looked at the way the paper was presented. I was disappointed. I mean, I was like, wow, beautiful work not properly showcased. And that's the problem with most of the work we do in Nigeria and in some developing countries. We do beautiful jobs, but we don't analyze them properly. So we need to make sure that if we have done our study, we need to engage experts in data management and data analysis. In fact, before you start the research, you must involve them so that they'll be able to tell you what and what variable you need to study and you need to bring in. So that is very important. The next question is, are the methods which you've applied and the measurements which you have made or which you have used valid and reliable? Sometimes a lot of us do beautiful works, but we are using methodologies that are already outdated. We are using instruments of measurements that are, confounded with so many factors. And so for that matter, they will not be valid. So if you want to publish in Lancet, the editor will just reject it ab initio without a second thought. If you want to publish in New England Journal of Medicine, nobody will accept it because you have used methods that are not valid. So your outcomes, the outcomes of your research will be flawed, because you need to know that in research, whatever you put in is what you get. So if the instruments of measurements are not valid, your results will be false. Not because you've done something, you've done a fraud, no, but because you've used research methods that are not valid and accurate and reliable as of today. So fully knowing this. So if you are a doctor and you want to do a research in basic medical sciences, for instance, you need to bring in a basic medical scientist, somebody who is a researcher in basic science. Bring in somebody that is a scientist. Bring him in as a collaborator and look at the clinical work or the clinical questions you want to answer using the laboratory, and they will have adequate expertise to provide you with all the support you need, and then you will have a very beautiful and a very high yielded research. Then the last question you may wish to ask yourself is, do your findings tell a nice story, or is the story incomplete? I remember during my PhD, when I was writing my research article in an area of basic medical science, that is so, there's so much paucity of data, almost not there. And I needed to write on that particular hormone. And then I remember my supervisor would always say, Ezekiel, you need to tell a nice story. And then she would not start telling me this story. Nice story. And I tell you, after going through that paper, I can't remember in fact, I lost count to the number of, editings that we did for that paper. But at the end of the day, we published that review article in a very high impact journal. So what am I saying? We need to tell a nice story. That way, I know some of us might not have very good skills in academic writing, but you can involve people that are very proficient in academic writing using our platform that is organizing this, highly impactful lectures and research modules for you guys. If you have any problem with academic writing, I'm sure if you contact them, they'll be able to link you with some of us that have got some knowledge in academic writing, and we can help. So it's very important. Don't just write anything. Like the other paper I told you that I read, I found, the nice study, nice everything, but my goodness, the English was awful. The whole writing was terrible. And I saw the journal was also terrible. But I tell you, if those researchers had adequate academic writing support, I tell you, they would have published in a very high impact journal of at least 5, because it was a huge work they did. But unfortunately, because of some of these lapses, some of, because they didn't have the knowledge perhaps you are getting today, their work was lost in a journal that will not give them any name. Now, the next consideration you need to have before you start writing your paper is publication goals. What type of manuscript do you want to publish? Is it an original manuscript? Is it a review article? Is it a case series, case report? What is it? And then who is your audience? You need to know. Is a journal a professional journal? So if it is a professional journal, a clinical research will be preferable. Because if you bring in a basic research journal like the one I published in Journal of Physiology to a clinical journal, nobody will read your work because they will not understand what you're talking about. Not because they are not intellectuals, but because that is not their interest. So your audience should inform the type of research you're doing or the type of research you want to publish. So if you have done basic, or if you have done a clinical research, look for a clinical journal or a clinical focused journal and publish your work. If it is a basic science research, look for a science or a medical science based journal and publish. That way you'll be able to, have a name for yourself. And then the question is, which journal? A lot of times, many of us don't want to publish in good journals because we say, oh no, we don't have 3,500 pounds to pay. We don't have $5,000 to pay as article processing charge. Yes, I understand with you. I agree with you. We are coming from, emerging economies, and all that. We do, most of our researches are not funded most of the time. It's a little tricky to publish, but I can tell you there are ways you can publish in high impact journal without paying a fee, because we've got journals which accept articles and they publish their work for free. All you need to do is to search for those free journals, not predatory, but free quality journals that collect nothing. So long your work is highly scholarly and highly intellectual, they will accept it. Then the third consideration before publishing is the audience. Are they medical specialists? Is the audience multidisciplinary? Do they involve research of diverse experience or researchers of diverse fields? Or is it just a general audience? And then you need to ask yourself as well, is the audience global or local? So for instance, you've done, let's say a chart review on the pattern of mortality amongst newborns that are being admitted into neonatal intensive care unit of your hospital, maybe for the past 10 years. That's a research question I'm telling someone. You may wish to undertake that if you have interest in child health. And then maybe you've got beautiful findings and you want to publish. It will be worthwhile to publish in a local journal, maybe a journal in your hospital, a journal in your state, rather than wanting to publish in Lancet or New England Journal of Medicine, because they will not accept your paper. It's a local work. So a local journal will be very it will be preferable, because there people will want to read, and there people will want to see, oh, what is happening in our hospital, what is happening in our state, what's happening in our country. And then finally, you need to think about authorship from the very beginning. Don't just put people's names when you are about to submit your publication. No, from the very beginning, plan how you want to arrange the list of authors. Who is the first author? Who is the last author? I want to tell you, the lead author is someone who is who is providing leadership, is someone who is providing, who is a driver, if I may use that word. The first author is the captain of the team. The first author is the sailor of that particular, of a ship, of a certain ship. And so the first authors provide leadership, provide direction, provide guidance, and then they provide coordination. And then you've got the last author. I know that one is not common in our country. In Nigeria, predominantly people think the last author is someone who contributed the least. No, the last author in modern research is the most senior academic, most senior researcher who has provided leadership and who has provided clear guidance in the course of that research and in the course of that publication. So we need to know. Then the arrangement as to who is the second, third, and fourth depends on people's contribution. So please think about authors and authorship before you even start your work. Now, what are the types of manuscripts or papers in medicine you may wish to publish? Original articles. And then this article usually, herald from original research that has been conducted. And then you want to publish the outcomes of such research, meaning that you are using primary data which you collected from the patients, either biological or clinical, to publish. And then we have got what we call latest, rapid, or short communications. Then we've got case series. Then we've got case reports. And then we talk about reviews, such as systematic reviews that I've talked about before, as well as scoping reviews and then review articles. Now, which journal to publish in? What are the important considerations? Number one, the aims and scope of the journal. So before you publish in any journal, you must check the journal websites and then look at the recent articles, see the types of articles, see the degree of intellectual input in those articles before you put in your article. Otherwise, if your article is not as strong as some of the articles that have been published in that particular journal, you will just waste your time, because you will send it there and then they will tell you, we're sorry, your manuscript is not publishable. And sometimes it can be heartbreaking. You don't need that. So always check aims and scope of every journal before you publish or before you send in your manuscript. Number two, what types of manuscripts do certain journals publish? Because there are journals that are specialized in certain types of manuscripts. There are journals which accept original articles, reviews, case reports, and so on. Some journals do not. So if you have a case report of a rare case that you have seen in your practice as a specialist, as a trainee in medicine, and you want to publish, you don't just go to Lancet and publish. You don't just go to Nature and publish. You need to know, does Nature accept case reports of that nature? Otherwise, you look for another journal that is applicable. And then you look at what impact factor. Please, colleagues, don't waste your valuable data in a journal that does not have visibility. You would not have a name for yourself when it comes to research, particularly if you are interested in academia. look at credible journals. Even in our countries, developing countries, we have got journals that have, some, significant impact factor that you can publish in. But don't just say, oh no, this is it. This journal, they don't waste time, they don't trouble people in their review process and all that, and you want to put in there because you want to count numbers and become a professor tomorrow. No, don't forget, quality is better than quantity. You can be a professor, but when you go for a conference, you will run away when there's time for, expert input. Why? Because you've not, acquired adequate depth of knowledge. So please, I'm sure this presentation is to help us become, great academics, great researchers, and great intellectuals. Then citation scores. Today people are, most journals are going away from impact factor. Now people are beginning to talk about citation scores of journals. So you need to look at citation scores, how many people read those journals, how many people cite those journals. That way you're able to know where to put in your work. And then, of course, I've mentioned this before, the article processing charge. That is very important. Of course, a work that is not funded, you can't say you want to publish in Lancet, you want to publish in New England Journal of Medicine, you want to publish in Nature. You don't have that money, but there are good journals that will not require a penny from you, and you can publish there and still have a good name. Then readership, I've talked about that one. I will not expatiate on that at this moment. And then time from submission to publication, very important, very, very, very important. There are journals that will take forever to get back to you. And let's say you are an associate professor, you want to put in for your full professorship next year, and then you have 3 papers in such journals. And then you need these papers to get your promotion. If you publish in a journal that will take a year or 9 months from submission to publication, it means it will delay your promotion by 1 year. So wisdom demands that you look for a good journal that will not require that length of time, so that you can get your promotion in a, as required. Then we talk about what? Acceptance rate. Now, you want to publish your work in a journal which acceptance rate is 10%. And then you are publishing from a developing country. Your work was not funded. And then you did your work by yourself. There was no collaboration. It's very difficult to have your paper being published in such journals. So you need to look at journals which have modest rate of accepting manuscripts and papers, particularly when it has to do with medicine and basic medical sciences. And then you need to look at the indexing of journals. Is there a platform that such journals are being indexed? If there are no platforms, if there are no databases where the journal you want to publish in is being indexed, please run away, because you will just waste your data. You will just waste your energy. A lot of people have done critical work, great studies, even in our institutions at home in Nigeria and in other developing countries. But because, we didn't have this understanding, we just throw in our manuscript in any journal that is willing to accept our papers. And then at the end of the day, people realize that, oh, the journal is a predatory journal. And I'm sure you can guess the outcome. Is heartbreaking for a researcher after you spend all your money, and then at the end of the day, there is no academic or scientific benefit from your hard work. So you need to look at, for those of us in medicine, we need to be sure that the journal we want to publish our paper in is either indexed in Medline or PubMed or CINAHL for nurses, for paramedics, and then or Scopus. And then other databases like Google Scholar, Web of Science, all these, the index, journals from diverse disciplines, medicine, engineering, science, and so on. Then now we quickly go to the myth. From what I have said so far, you could quickly apply that in what I want to quickly discuss, and I can tell you your academic or research journey will be seamless and will be fruitful and will yield results. So we will look at practical steps in writing impactful manuscripts in medicine and basic medical sciences. So just look at this article structure. This is from Elsevier. Just for you to know that this was extracted from Elsevier document. For you to see the steps when you want to, the structure of an article before you submit. On the title page, 4 things are critical: the title of the manuscript or the title of the work you've done, the authors and their affiliations, the abstracts and keywords. You need these. They are very, very important because they help in the indexing of your research work. Otherwise, if you don't put the right words or the right people, people will look for you, they will not find you. And then in the main text, you use this acronym that is called IMRAD. I is for introduction, M is for methods, R is for results, A is and then D is for discussion / conclusions, depending on journals. And then finally, you talk about acknowledgements, references, and then other components depending on the journals. Now, about title. What do you need to know about having a very captivating, a very, highly impactful title? Number one, you need to know a title should be simple, specific, concise, and not complicated. Don't use medical jargons in writing your title, because readers that are not sophisticated will be put off by your title. Even the editor might not understand what you're saying, and right there and then he will reject your article. So we should be very simple in writing our titles. It's not by using complicated words that people know that you are an intellectual. No, it's the scientific input and reasoning that is most important. We need to use fewer words possible, but adequate enough to describe the content of our manuscripts. Our titles should be captivating to attract readers' attention. Titles should not be long, should not be too long to distract readers. I'm sure if you are a good reader, there are papers you have seen just from the title you just ignore because you feel like, oh no, it's not interesting. We must avoid redundancies, such as a study of, you don't need to, you just write what it is. Observations of, just tell us the observation. You don't have to say observations of, and then some people will not say northwestern Nigeria or northeastern Nigeria or southwestern Nigeria. You don't need that. Just tell us specifically. Because all this, if you have, let's say you want to send your manuscript to a journal that is multinational, let's say a Lancet Endocrinology, Lancet Cardiology, or let's say Lancet Nephrology, or Lancet Psychiatry, and then you put in northwestern Nigeria. From the very beginning, the editor will like, am I sure this work is credible? Am I sure all the needed resources have been put in? From the very beginning, it doesn't matter what you have done. They can easily say, no, this work, rejected. No adequate information, no adequate data. Go back to the lab or go back to the field. But when you are very focused and specific, like there was a paper, one of my fellowship work that I wanted to publish a few years ago. And because I've had this understanding, all I said was, prevalence of so and so in Nigerian men with type 2 diabetes. Specific, I said Nigerian men. I didn't have to say Zaria, not Western Nigeria. It doesn't make sense. I don't have to. So we need to be specific. Of course, I know it's gradual. At the end of this lecture, you will have access to some of us, and then we may be able to guide you if we have the time. And then about authors, I've talked about that one before, but just to quickly make clear this point. The International Committee of Medical Journal Editor stated that an author should meet all of the following conditions. Number one, has a substantial contribution to study proposal and design, data collection or analysis, and data interpretation. An author must be someone who critically prepare or revise important manuscripts, contents through intellectual ability. And an author should be someone who provides final agreement on the revised article for publication. But the question is, why do we still have people who are associate professors and they have never first authored a paper? That is disheartening. That is not acceptable in our universities. We must change the trend. You and I must change the trend. And that is why you are here today. And I'm saying, list authors' names followed by their affiliations if they have met all of the three conditions for authorship above. Abstract, very important. A good abstract should be precise. A good abstract should be able to stand alone, meaning that without reading your full manuscript, from your abstract, I should be able to say this is the thrust of your work. A good abstract should be brief and specific, minimize abbreviations, and must not be cited. A lot of people cite abstracts. Do not cite abstract. If you do that, if I am an editor, right straight away, I will reject the paper. Don't cite any abstract. The quality of your abstract can strongly influence the editor's decision. Take note of that. Sell your manuscript through a good abstract. An abstract could be structured or unstructured. Always check the journal's specification. You may be asking me or asking yourself there, what is a structured abstract? What is an abstract? And what is an unstructured abstract? A structured abstract is a form of abstract which has got background, aim, methods, results, and conclusion or discussion spelled out clearly. An unstructured abstract is an abstract which includes background, aims, methods, results, and conclusion without breaking them into specific components. A good abstract must report mainly important, significant results, and the conclusion must be brief. A lot of times you see people publish negative results in their abstract. Obviously, that paper will not be accepted. You should get those very interesting results and showcase them in your abstract. And make sure when you're writing your conclusion, it must be in present continuous tense or present tense. Don't write your conclusion in past tense. You will see people will say, our study found that. No. They will say, some people will say, our study showed this. No. You said, our study findings are this. Our study findings suggest, our study findings imply they must be in what? In present tense. Now, main text using the IMRAT method. You have to start with introduction, which is also known as background. And then you talk about your methods, you present your results, and then your discussion or conclusion, depending on the journal. by introduction, what are the components or what are the things you need to know about writing an introduction in a medical article? One, you need to know that an introduction must be aimed at revealing the gaps in current literature. It's not just literature review as if you are writing a thesis. No, you are looking for the gaps to fill in. And so you must be able to also showcase the gaps in your introduction. You need to explain some of the additions to the existing knowledge in the field you are about to publish. You must highlight the novelty in your work. A lot of times we've done credible work, but because perhaps we have not studied widely, we do not know that our work, has got so many novel findings. So if you've got novel findings in your work, make sure in your introduction, particularly in the last paragraph, to indicate clearly that this is the first time so and so is being investigated. Or you say we are the first to investigate this and this. That way you are trying to show novelty and groundbreaking research. We need to know that in introduction, you must state your rationale, the significance of your work, and the aims of the study, particularly in your last paragraph. You need only 2 to 3 paragraphs in introduction. Do not write a thesis. I've reviewed a couple of papers, and you will see people will write introduction, they will write and write and write and write and write. At the end of the day, the reviewer is exhausted, he loses focus, and then the response might just be negative. So please, you need 2 to 3 paragraphs at most. Some people even accept 1 to 2 only. And then you must cite important references. Do not ignore contradictory studies. So don't just write, oh, et al. Found this. No, there are times you will say that, oh, another person in another place found a different result. That way your work will be a mixture of scientific engagements and diversity as well. Ensure you are telling a story. Be logical. Start from prevalence, start from risk factors, after prevalence, risk factors, complications, and then you talk about specific papers or articles or people who have looked at those areas and you present. Don't just mix them here and there. Obviously, from the very beginning, it will be rejected if it is not logical. And then methods is one of the most important components of a medical research article. Your methods must be reproducible. So if you are using a certain method, let's say in Lagos, and another person in England is using the same method, they should arrive, at the same result. So we have to make sure our methodologies are reproducible. Don't create your own methodology in your room. Nobody will accept that paper. Number 2, you must write your methods in this format. But this is just a guide. You need to know that different journals have different formats. Take the journal and then write the way. In fact, before writing, start thinking of what journal you want to publish your work in and write your manuscript according to their guidelines. But based on my suggestions today, I would like you to follow this guide. It's easier, it's simple. At any time, you can easily rearrange. Number 1, in your methodology, start with study design. What is the design of your study? Is this a cross-sectional study? Is this a prospective study? Is this a chart? Is this a retrospective chart review? Is this an experimental review? Is this a randomized, double-blinded control trials? Make sure you state the study design clearly. 1 or 2 sentences, or 1 or 2 sentences are enough. Number 2, study setting. You need to look at the study setting. Is this a hospital setting? Is this a community? Is this a population-based study? You know, is this a ward-based study? You need to make it clear. And then study population. So you need to think about sampling method, inclusion and exclusion criteria, and then ethics consideration and participants consent. You need to know you cannot publish any paper without ethical approval, particularly if it is an original paper. And if you're publishing a case report, you need to know that that particular patient must give you permission, must consent to you publishing, their clinical data. Don't publish a work without consent of the ethics committee or patient's consent, depending on the type of research you are doing. So ethical consideration is very, very critical. It is not just acceptable, it is moral, and if that is flawed, it can lead to sanctions and so many punitive measures. So please make sure, don't just go and grab patient's case files, patient's case notes. Don't just go to your EMR, that is your electronic medical record, and grab data and start publishing without ethical considerations. Do not do that. Make sure before you publish, you get approval from your ethics committee. As the case may be, you may want to get consent from your patients. You need to know that clinical data and biological sample collection method must be stated clearly. How you want to collect your clinical data, how you want to collect your biological samples. You must explain methodologically how you want to do that. And then all your laboratory methods, is it Western blotting? Is it ELISA? Is it real-time PCR? Is it proteomics? Is it, metabolomics? Whatever you want to do, make sure those are stated clearly. And then your statistical analysis methods must be stated clearly. What statistical tool are you going to use? Is it SPSS? For us in biomedical research, the best tool to use is graph path prism. Although I know you have to subscribe to it, many institutions in developing countries do not have access to this because you must subscribe. But again, if you have the money, having this is very, very essential. It's very, very, I have got this, and it's a great tool. You can play around with your data every moment and see how it is before you attempt to write up your results. Or is it Starter for those of us that deal with huge data, those who are epidemiologists? Is it R in this instance and all that? So, but again, in this particular session, you need biostatisticians to support you on what tools you need in trying to analyze your data statistically. Then results presentation should be in a logical sequence. Don't just put anything anywhere. You can either use text, tables, or figures to summarize your data. You need to know that in writing your results, you must start with the main or most important results. Don't start with negative results. Just like how if a young doctor or a trainee physician is presenting before a consultant and you are saying the patient is anicteric, the patient is acyanose, the patient has no pedal edema, but the patient is pale. I'm sure you can predict the response from the consultant. He will be furious. He will not be happy with you. Why? Because he expects you to say, this patient is pale. However, this patient is not dehydrated. This patient is anicteric, is acyanose. Why? Because that will be clear, and it shows that you are prioritizing, your findings. So also in research, don't tell me the negative result. Don't tell me, oh, there was no statistical significant difference between women who smoked cigarette when they were pregnant compared to women who didn't smoke cigarette. No, tell me that there was a significant difference in terms of fetal outcomes in women who drank alcohol and those who didn't take alcohol when they were pregnant. That is what the reviewers and the editors want to see. Now, you also need to avoid repetition. A lot of times people will keep on repeating things. I remember when I was writing my fellowship dissertation, sometimes I remember that time as a baby researcher, you will have written it in a text, you will show the tables, you will show the figures, all representing the same thing. No. If you want to publish in a high impact journal, you need to make sure that you either use narrative method, or you use tables, or you use figures to present or to summarize your data. If you must combine at most two, then you must make sure that the second one is complementary or is only for emphasis basis, or you are trying to highlight the importance of that findings or that finding, as the case may be. You must show the results of your statistical analysis. Don't just say there was no difference and you are not telling us the p-value. That will not be correct. You must always tell us the statistical findings, the mean, the standard deviation, or the mean error, or the standard error of mean, or you want to use, whether you are using median, you must state that, or you are using, confidence interval, you must state that, and you must state the p-value. Always use past tense when you are presenting your results. Don't use present tense, as I've told you before, when you are writing your conclusion in abstract. And then write a comprehensive legend for every table or figure. And the idea is that you want every table to be a standalone. You want every figure to be a standalone, meaning that if I just take your table without reading your text, I can clearly understand your findings and understand what is the implication of your finding. Then we come to the most important section of a manuscript, that is discussion or conclusion. You need to ask yourself a few more questions again in this section. Number one, are you selling your data? Where do you want to sell your data? Is it in methods? Is it in results? Or is it in discussion? You need to know that the discussion session is where you are to sell your research data, because a weak discussion is a major cause of rejection. And for those of us writing dissertations, or either master dissertation, fellowship dissertations, or PhD theses or dissertations, you need to know that the most likely cause of your failure in your defense or in your examination of your thesis or dissertations is what? Is poor methodology, poor result writing, and then poor discussion. If you like, you write your literature review or introduction 100 pages, nobody cares, because all you are writing there is somebody's work. But your main work, if you don't present your work properly, you cannot pass. That is why you see a lot of people, when their PhD thesis examination report comes back, depending on how many examiners, and then you see them crying, saying, oh, this and that, they were victimized, they were this. No, perhaps you didn't do justice in your methods section, in your results section, and very importantly, in your discussion. You need to know that discussion chapter describe what your results actually mean. Your discussion tells us the relationship between a study's findings and other studies. So this is what you found. You found that, look, young people who take or who abuse substances, are at higher risk of dying before they turn 40 compared to their age-matched counterparts who did not abuse substances. Now, that is your finding. But you need to tell us that A et al. In 2022 found out that there was no difference between young people who abuse substances, and those who did not abuse substances in terms of mortality before they turn 40. So all this you need to put in perspective. So you must put that relationship between your findings and others, whether positive or negative. You must expatiate that. It tells the reviewer, the examiner, and the editor how much of intellectual input that has come into the work. And then you must also explain clearly the limitations of the study. Don't just tell us, or don't just tell the examiner or the reviewer that, oh no, this is an excellent work, this is the best work, I've done this work, nobody has done this work before. Yes, but perhaps there are certain things you would have done. You need to let the reviewer or the examiner, if it is for degree purposes, or even the editor, to know that, look, yes, we found this, we found that, we found this, but the limitation of this work is that we didn't compare between this and this. We didn't, factor in some of the confounding, factors. We didn't look at this area because of lack of money or because there was not enough time. So that must be put in. Limitations of the study must be clearly stated. And then when you are writing your conclusion, you need to bear in mind that very important information that you need to put must include presentation of your study, novelty to the field you are studying. Let's say you are a cardiologist. You need to tell us that in that field of cardiology, what advances is your research work bringing to the fore? What is the application of your findings? Perhaps you found that those who, let's say, take at least 2 bottles of Coke every day are at high risk of developing high blood pressure after 10 years. And then now that is a new knowledge in the field. Now the question as to applicability will now come in this format. That is, if people minimize minimize Coke intake, the risk of what? Of developing high blood pressure in 10 years will be reduced. That is an application of your research work. And then part of the conclusion will now be that you must provide, clear, concise, and intelligent recommendation to future study in your area of endeavor. Having said all this, you need to know that critical references in your introduction and your discussion chapter must be referenced. Even methodology. There are methodologies that perhaps maybe in some methodology you might have cited some researchers. Make sure you put their references down, but always check the journal for specifications and formats in terms of referencing. You must write clearly author's contribution, who did what. You must put it down in a very clear fashion. And then you need to acknowledge people, those who help you. Of course, it's not everybody who helped you in your research that is qualified to be an author. So somebody who helped you in collecting your data, please, you can acknowledge them. Let's say you have medical students helping you, you have research students helping you, you have postdoctoral fellows in your lab helping you. Maybe you have other people helping you in another way. You can acknowledge them, but do not list them as co-authors if they have not met the definition of authorship. Then conflict of interest, you must state clearly as well. And then funding, you must also state clearly. If you have got funding, or if your work was funded, state it clearly. If it was not funded, state it clearly. And that way, it will help in people, understanding your research work properly. Now, what are some of the important resources you need to have, or you need to know when you plan to write a high impactful article in a medical journal or in a basic medical science journal? Number one, you need a grammar editor, such as Grammarly. That is very critical, because sometimes maybe English might not be your first language, or even if you are very proficient in English, but there's a difference between general English between general English and academic English. So that should be clear, and the use of these grammar editors will help you, or will help your manuscript to be very, very publishable. And then you need to use research managers, which will help, or citation managers, which will help in your citations of references and so on. We have got very notable ones, such as EndNote and Mendeley. I use EndNote, and I can tell you it's fabulous, very fabulous. I've been using Grammarly since 2019. It's fabulous. Although you might have to pay, and so on. But if you are based in an institution where Grammarly can be subscribed, please try to be part of it. And then statistical tools that you need to have. I've mentioned this before. GraphPad, Prisms for those in biomedical research. You can use SPSS. SPSS has got its own limitations in terms of biomedical research, but it's also very good. You can use R for those that use large data, and you can also use Stata. And then very essential, you need to have a biostatistician or an epidemiologist at the very beginning of your research planning. Very, very important. And then finally, you need academic writing editors to support you in your manuscript writing before submission. Thank you very much for your time. And then if you have any questions, I'm right here to provide you with all the support you may require at the moment. You can find my contacts. My email is here, and my WhatsApp number is here. If you want to ask any question, you want collaboration, you want mentorship, you can get in touch with me, and I'll be glad to assist. Thank you very much.
All right, thank you very much. Just before we delve into the question and answer session, we'd just like to take a few minutes of your time to give a few announcements. So the recording for this webinar, this presentation, and also the slide will be shared with us via our respective emails. So we would need to stay tuned, and would need us to stay tuned on our WhatsApp platform. There's a WhatsApp platform, but just in case you're not in the platform yet, shortly after the announcement, I'll send the link to the platform so you can join the platform and stay tuned for updates. Now, just like this webinar, we've also held other webinars which we think might interest you. Here's one on the effective strategies for successful and on-time degree project completion. This webinar on the effective strategies for successful and on-time degree project completion was facilitated by Dr. Jagmohan Singh, and it might just interest you to visit our YouTube channel to learn from this webinar. We also have academic content, a webinar on academic content that was presented and facilitated by Dr. Asharani Patel. And we also have another webinar on the nitty-gritty of academic and grant writing, which was facilitated by Dr. Wadzani Dauda. And we also have another webinar, which was on securing scholarships for postgraduate studies. These and other webinars you would find on our YouTube channel. The link to the YouTube channel will be shared to us shortly after the announcement so we can access these webinars. And also, in the coming weeks and coming months, we'll be having other webinars. And this is a webinar that is scheduled for the 23rd of March, 2024. And it's titled Strategies, Software, and Techniques for Crafting Compelling Figures and Diagrams in Academic Writing. And it will be facilitated by Dr. Mauli Kwamla Azameti, who is from the University of Technology and Applied Sciences in Ghana. So this webinar would interest you. Please stay tuned on our WhatsApp channel, on our WhatsApp platform, so that you can receive more details on the webinar. And also in the coming month, we'll also be having a webinar on juggling science and family, striking the right balance, and to be facilitated by Professor Folashade Olajuipe, who is a professor of biochemistry from the Federal University of Technology, Akure. So please stay tuned on our platforms. We have so much in line. We have so much in store for you in the coming weeks and in the coming months. So please stay tuned on our platform for the links and for more details on these webinars. Official flyers will be coming out very soon, and there will be other webinars that we would need to stay tuned on for. So next we have this course, certificate course on the 25 types of research gaps and how to conceptualize novel, innovative research ideas. Now what you learn from this course is that you learn techniques to spark innovative research concepts, you learn strategies to refine and structure your ideas effectively, you learn tips for aligning your research ideas with grant criteria. Just these and so many more you'd learn from this course, and a certificate will be issued after completion of the course. So visit our website at www.academicenclave.org. The link to the website will also be shared with us very shortly after this announcement. Visit our website and grab your opportunity, grab your seat. Also, we have from the Academic Writers Academy, which is a faction of the Academic and Grant Writing Enclave, we're holding a training on high impact research paper writing. We have successfully trained over 100 persons in the last 3 months. And what this training does for you is that it boosts your academic writing and your publication skills. You learn journal publication strategies and submission guidelines. You get tailored guidance for selecting journals. You learn collaborative learning for refining your writing style. We have very seasoned facilitators from different fields who would be here to answer your questions and help you to gain more from this training. So visit our website still on www.academicenclave.org and grab your seats. In fact, we have the chairperson for this present cohort, that's cohort 2, in the house in person of Professor Hafsa Ahmed. So shortly after now, we'll be giving her the mic so that you can also hear from her. Next, we have another training, just because we are interested in fostering academic excellence. Another faction of the Academic and Grant Writing Enclave, which is the Research Innovation Academy, has presented this 6-week training course. And as you can see, we have modules ranging from module 1 to module 9, and you'd learn a lot, you'd gain a lot from this 6-week training. And a glimpse of it is that you gain insider's guide to research methodology. You'd learn to identify research gaps and ideation techniques. You learn creativity and innovation process, brainstorming techniques, mind mapping and journey mapping, text mining and data scouting, innovative idea refinement, and sustaining a creative mindset. You learn on fundings, on grants, and on support opportunities. And that's not all. You're not just walking away with innovative mindsets, but also a recognized certification, a certificate at ISO, CAC, and many other international bodies recognize as certificates. And you'll also be working with a 1,303-page document packed with grant opportunities worldwide, and it is valued as an offer of 534,990 euros. But you're gaining all of this for free once you register for our course. So thank you very much.